Hi, good morning. Thank you for joining us. My name is Vicki Lowe, and I am the Executive Director for the American Indian Health Commission of Washington State, which means I get the pleasure of working on behalf of the tribes and urban Indian health programs in Washington State. And today we are having a panel to talk about the evolution of the tribal partnerships with the ACHs across the state. And because of time, I understand that the bios of each of the presenters is going to be put in the chat box. Is that correct? So I'm going to do like a very brief, just say who everybody is and where they're from. So today we have with us one of my favorite tribal leaders and role models, Marilyn Scott from the Upper Skagit tribe. We also have Santana Rabang from the Children of the Setting Sun Productions, Dr. Dan Barbara from the Colville tribes, and then Jessica Small from the Chehalis tribes, or the Confederate tribes of Chehalis. Okay, I see so I'm sorry for it. It's kind of awkward for me not to do bigger introductions because that's not like how I was taught, but the bios are in the chat box for you to look at. Some of the work that the commission has done with Medicaid transformation was really back in 2016, 2017, the state, the healthcare authority contracted with us to help with the engagement between tribes in these accountable communities of health as they were being built. And we were engaged very early in the Medicaid transformation work, almost so early that we couldn't really wrap our brains around it. But it was that's the appropriate way to work with the tribes as governments and the urban Indian health programs, the Indian healthcare providers. And there was a lot of concern from the tribes about these accountable communities of health. Would they actually stick around? There's kind of a history of these different entities popping up and then engaging with tribes and then disappearing. Will they be able to really respect the expertise of the tribes and the Indian healthcare providers? And also in each region, there are some distinct historical barriers for working together, things that have happened. So there was a need to build trust. And I think the one thing that really struck me was the thing that happens a lot was that the state and the ACHs had this idea that they needed to help the tribes, but I knew all along that really they were going to get to know the tribes and realize, all the great expertise and innovation that was already happening at the tribes and the urban Indian health programs. And we knew that it was important for these Medicaid transformation funds to really be used to support those innovations that are already happening because of the chronic underfunding of Indian health services. Tribes and the urban Indian health programs had really maxed out innovation, and really what they needed was funding and support of the work that they were doing. And that's how we really wanted to leverage the Medicaid transformation funds. And tribes were really worried about, having a lot of meetings with ACHs and having them not really turn into anything that helped with that kind of work. So one of the big bones of contention was tribal representation on the ACH boards. At first, there was the idea that only one tribe could have a seat based on, the other sectors having seats. But we know from working with tribal governments that one tribe cannot represent another tribe. Each tribe has their own unique ways of doing things, and they can represent their own people, but each tribe really needed that representation. So as time has gone on, the ACHs have recognized this a little bit more. So that's kind of the history. And I am going to go through and ask each of the panelists to talk about what your perspectives are on the appropriate engagement with the tribes. What does that look like? What does that look like in your region? And then what is important to know about when working with tribes? And then also any lessons learned and successes. And normally I'd ask the elected leader to go first, but Marilyn, did you still want to go last?
I think I'd prefer to just close out our session.
Okay,
thank you.
Thank you. Again, I feel like I'm breaking all these rules. So thank you. So because you're first on my screen, Dr. Barbara, do you want to go first? So the first question is, what does appropriate engagement look like with the tribes or with the Colville tribe? And you're muted, just in case.
Yes, thank you, and good morning, and thank you for the opportunity to be here. And yes, I'm typically would defer, of course, to elders and to elected leaders, but I'm happy to share first, and then I'm sure that they will correct or add to anything that I might say. Much value. So I start by saying that I am not Native. I did grow up on the Colorado Indian Reservation in Arizona, and have had the privilege of working in and with tribal communities my entire career. And so I've learned a great many lessons as a result of that. I think with the unique perspective of coming in as an outsider, which is no small challenge, to realize the importance of collaboration and the values that the tribes place upon collaboration, collaborative work. I think it's really critically important to understand that, while partnerships are very much welcome in Indian country by Native American tribes, and tribal programs that are doing great work, that already have the capacity to do great work, there are priorities that pre-exist these partnerships and collaborations that need to be respected. But those partnerships, those collaborations, should never be meant to just tick the box, so to speak. When you come into Indian country to work, it should be genuine, with an intent to provide options and additional funding and resources that are not available, to partner with tribes to make sure that their priorities are able to be carried out, to coordinate services with those that are already working, that are already designed and implemented in the community, and then to support those efforts, bringing in additional ideas, concepts, value add, evidence-based things that have not already been tried, is often very welcome, but only in the sense of, but only if it's done in a strategic and respectful manner. That work must be genuine and fit with tribal priorities, and collaboration needs to be mutually beneficial and based on mutual respect, never prescriptive. You would not go to your mentor's house, if you've ever been in a professional mentorship program, your mentor's home, your mentor's role, and try and tell them what to do and give them direction. You would rather learn from them. And if you've worked in the medical field or health services at all, oftentimes students have great value add and can share and have great input. But when you come into a tribal community, it's critically important to never come in a prescriptive, this is the way we should do it, kind of role. If you come in with a respectful learning attitude, the input is typically welcomed and considered to be very valuable. I think it's important to understand that there are no two native cultures that are alike. Even on the Colville Reservation, there are many different cultures. My time working in Indian country across the nation, Washington, California, North Carolina, Arizona, I have seen some incredible level of diversity within tribal communities. I do think that there are a lot of things that are special and unique to Native American culture in general, if there is such a thing. And those are some values that I think that are super important and probably are as important to any relationship that we establish between governments, between programs, between people working together. Trust is generally earned, not just granted. It comes by way of bringing in unique and interesting perspectives and opportunities, not trying to sell it, but rather share it. Never duplicitously, never with overt intent to just, basically buy a tribal partnership to be able to, like I said, tick a box or use the name of a tribe or a tribal relationship to advance a cause, but rather in a genuine, very genuine, with a very genuine approach. Elders and children, I think across the board in Native tribes are considered to be extremely valuable assets, the most valuable assets of a tribe, and are to be respected in that process. They're the wisdom keeper, the elders are the wisdom keepers in the history of the tribe, and an interwoven nature of the family units. Between there's a value of family units and a value of family unity and collaborations, even alliances that has to be respected and should be noted by anyone coming in to work with tribes. Community involvement is not just something that tribes do. Coming from working in local government, we were required to engage the community and have community hearings regarding specific projects, such as in community development block grant funded activities. And there were very specific specifications about how those types of community activities needed to occur in order to ensure that the community had engagement and buy-in into new projects. That isn't really, requiring that isn't really necessary in Indian country. It's a natural intent, or as a natural outgrowth of Native communities, is that there is a high expectation that the community will be not just aware of, but engaged in, involved in, have an understanding of what it is that their tribal government will be doing. And of course, by extension, anyone working with the tribe. And I think that sovereignty and the ideas of sovereignty and self-determination that are kind of alien to those of us who work in other government, those of us who've worked in other government roles, and maybe are even seen as offensive. The idea that Native American tribes would be able to govern their own relationships and make a lot of their own rules and regulations and enforce their own laws. I think that it goes a long way to begin to try to understand why those self-governance principles are so important to tribes, that so much early on in federal and state government history was imposed upon tribes, and that things were done to them. It was said that they were being done for them or given to them, but rather they were imposed on them, and that really defined that early relationship and resulted in a lack of trust that we see now resonant in the values of self-determination and sovereignty. And I think that that's an incredibly important concept to be respected and understood, and not just a lip service too, but a real true understanding and respect for the tribal decision-making process as you collaborate with tribes, and not coming in with an intent to impose or implement new programs in Indian country, but rather to collaborate with tribal governments and programs in the community to ensure buy-in and participation, and to make the project work for and be highly informed by the cultural values of that community.
Thank you. I saw a lot of nodding. I think you nailed some of the concepts. Jessica, do you mind going next? You're the kind of next in my view of the Zoom. And I'll repeat the question. Just can you talk about the appropriate engagement with tribes or your tribe, and what does that look like? What is important to know when working with tribes? And do you have any lessons learned or successes you want to share about working with ACHs?
Yeah, so I think Dr. Barbara hit so many excellent points. But I think one thing to really drive home is, we have a lot of great programs And when we collaborate with other state entities, it's great if they understand that we do have programs and that they should help us support those programs and enhance programs we already have. Coming to us understanding like our goals for the community, our goals for their health, and breaking down the health disparities that Native Americans have is really important to understand with partnerships. I think they should really support meeting with tribes, coming and understanding our goals for our community members is I think a huge thing that I've seen, and thing that can be worked on even more. And I think that through this whole COVID plan, I've seen a lot more support than I have in the past 12 years. We've had a lot of great support coming out of this the past year and a half. And I think that, our tribes have been working our tribe has been working a little bit more closely with some of the state agencies, and my health director, Denise, is very involved with the agencies and meeting with the agencies. And she does a fantastic job of explaining our goals for our community and what our needs are, and then finding the appropriate collaborator to support us.
Sorry. Thank you, Jessica. That's a great addition. And then Santana, you have a unique role. I believe you work with a lot of the tribes. So again, the question or the discussion is about appropriate engagement with tribes. What does that look like? What is important to know when working with tribes, and any lessons learned or successes you would like to share?
Okay. First off, Naut Siam Nishalcha Santana Rabang Sana Snat Chachlamisin Nasli Konasqua Akukonasqua Outsin Hachitza Chlamichasin E Utatasin Quanis Tunal Haishka Quanisin Atachel Isai Tsinkletza Tina Quelia. Hello, my respected people. My name is Santana Rabang. I come from Lummi. I would like to share a few words with you. I don't know the Lummi language and I'm still learning how to speak it. Thank you for being here today. My hands go up to you. And to talk about what does an appropriate engagement look like, as someone who identifies as Native, I've been working a lot with ACH in collaboration with Children of the Setting Sun Productions in highlighting our surrounding tribes wellness programs. So I've had the privilege to visit Seattle, Tulalip, Swinomish, Lummi, and Nooksack, and we still have a few that we're working on as well. And then of course the work that we've done with Marilyn Scott for Upper Skagit. And I think throughout a lot of this process, I've learned to just be patient throughout everything. You see sometimes some hesitancy when it comes to working with non-natives just because of the trauma that we've endured since, first contact. So just to be patient within this process. It's obviously a really long process, but it's something that's well needed. And you can tell that there's this want and need for more of this collaboration between partnerships and tribal communities. So just being patient, of course, and there's always like a proper protocol that we've been following while working with these tribal communities. And that's just, kind of gathering permission first and not automatically assuming that this is something that they want to engage in. So really, Daryl has brought us to these communities, and we've typically, whatever idea we kind of have to present to them, we usually do it over like lunch or breakfast or dinner, and kind of create this like comfortability between each other. and just really get to know each other a little bit more. So within that protocol, we've, gathered permission and have sat with them and just really asking them what it is that they think that health partnerships should know and have an insight on, and just really asking them what it is they think that should be out there. I think is really good to engage in at first, and just to be there, to listen, to be respectful, and to I know typically we can kind of have like an individualized mindset, but once you change your mindset to, this isn't just individually, but collectively, and this is for, all of us, non-natives, natives, broader community, and everyone, I think that shift in mindset really helps people when navigating such experiences. And so, yeah, just being patient, asking permission, listening, and then also like looking at each other as equal. As tribes, we are sovereign nations and we have the right to self-govern, and so we are on this level where we are equal, and just how can we better engage in each other's work. So yeah. Hi, Shka.
Knudsen, thank you. And then we will round out with Marilyn, and then after Marilyn's done speaking, we'll have an opportunity for questions. So if you have some questions, you can put them in the Q&A and we'll go through and ask them. So my pleasure to introduce to you Councilwoman Marilyn Scott of the Upper Skagit Tribe. And Marilyn, do you want me to say the questions again?
Yes, if you would, please.
Okay, so we're wanting to know about appropriate engagement with tribes. What does that look like to you? And what is important to know when you're working with tribes? And then what are some lessons learned, successes over the past 2 years of working with the ACHs? Thank you.
Thank you, Vicki. And thank you to all of the other panelists this morning for sharing your experience with the state and from the tribal perspective. My family given name is Wichalitza, and I have served on my tribal council for more than 35 years. And it's very different from the tribal leader perspective in a working relationship with the state agency, organization, or partnership. And as a tribal leader, when the establishment of the legislation for and the waiver that established the accountable communities of health around the state, in the legislation, it did not identify tribal governments as being a sector that was required to be a part of the ACH. But that did not stop the tribal representatives in our region. And sometimes the North Sound Accountable Community of Health, from the tribal perspective, we call ourselves the troublemakers, in that at times when the ACH was being established originally, because the tribal governments were not identified as a required sector, but the tribes in our region were aware of the work that was going on in the state, and so we showed up at the meetings. And initially, the ACH formation and the organization that was being formed identified that there would be, in our region, we have 8 tribal governments in the 5 counties that are within the North Sound Accountable Community of Health. And it was identified that we would be able to have 1 tribal representative serve on the board of directors. And I was able to get a resolution from my tribal government to allow me to represent my tribe with the Accountable Community of Health. And, you know, I was not able to, it was not appropriate for me to represent all 8 tribes as the only tribal representative serving on the board of directors. And so when that, the formation and the bylaws of the Accountable Community of Health was being established, I said, you know, was recognized as a representative for the Upper Skagit tribe, shared the resolution, designated me to represent the tribe to serve in the capacity of representing the tribal government with the organization. But that we could not represent the other 7 tribes. I was not allowed to represent. And therefore, the establishment of the organization, they went back to the drawing board and they looked at the legislation and recognized that it was going to be, if tribes chose to designate a representative, they would be allowed to have tribal representatives serve on the board of directors by all 8 tribes, in addition to the sectors that were required in the legislation. So that was the beginning of the Accountable Community of Health and where we started our partnership. But it was a very good partnership because the Indian healthcare delivery system within our region and across the state is very different. The way we do business and the authorization of funding that we receive from the federal government, and how we operate with our other health partners in the region is very different. And so we needed to participate and listen and share when we could, the way of business that would improve access to healthcare within the region. And that was when we identified one way we could do that was Medicaid transformation in the state was going on, and the integration of managed care, the expansion to integrate physical health and behavioral health over the years, and now full integration. That didn't work for Indian country. Managed care does not work for Indian country in the way that our Indian healthcare delivery system works. And so we established with the state that we needed to form our own partnership. And in our region, we established the coordination between the 8 tribes with the Northwest Tribal Health Board, which is a tribal organization that has input from all 8 tribes within our region now. And we have tribal representatives that represent their tribes on our board with the Tribal Health Board. So our Tribal Health Board was one of the organizations that applied to be a partner with the ACH and receive funding that would benefit the 8 tribes in our region. And that was one way that we entered into partnership. But then also the Children of the Setting Sun Productions, they were able to provide some education and opportunity for our partners in the region to learn more about the tribal governments, the protocols, and the sovereignty of each of the tribal governments, along with our representatives that were from the counties, the county commissioners, the city, and the local health jurisdictions. They were all partners in our region that needed to have access to communicating with the tribal governments and the Indian healthcare delivery system. And with that, in our region, we have formed also an agreement with the local hospitals and the counties. And the Tulalip tribe has an agreement with the Providence Hospital. And we have entered into agreement with the, to have liaisons that work at those hospitals to assist our tribal people navigating when they need to be in the inpatient setting and the healthcare system as during the pandemic, and the protocols and the requirements for not being allowed to have visitors. That was something that was really hard for our people when they had somebody that was in the hospital. They're usually the family, not just the immediate family, but many friends and relatives would participate in following that person to get better. And the way the protocol of the hospitals were is that you were not allowed with the COVID visitors in the hospital setting. So we were able to navigate that with the partnerships that we entered into with our local hospitals, in being able to get identified, a minimum of one person that would be the spokesperson for our relative that might be in the hospital, and sharing information with the relatives and family that were concerned about this individual. So those are the kinds of partnerships that are success stories that we have had within our region. We have all of our board has visited the tribal communities. That our whole board visited Lummi Nation, and we were able to tour their Schlangen housing project, and we were able to visit the Degwalik Wellness Center and the medication assisted treatment program. We were able to visit a number of the tribal health programs, so that all of us were understanding the type of care and the improving access to healthcare in our region was benefited by us being open to visiting the counties. We have had our board meetings in the individual counties as well, so that we can actually see what is going on in the communities in the various counties that are within our region. And so we have been positive partners together during this pandemic, and sharing resources, serving the families that have been impacted by COVID, improving access to all levels of care, has been a benefit of the work together of the tribal governments and the accountable community of health and our local jurisdictions. We did a lot of work around accessing the countermeasures that have been required during the pandemic, and the tribes across the state have been working directly with the state and Department of Health in accessing supplies that we may need, the vaccine, the PPE, the things that our communities needed to benefit our population, because we serve not only our tribal members, but all citizens that live within our reservation boundaries. And our tribes across the state, some of the tribes have thousands of acres, and then we have tribes that are very small. My tribe is very small. Our community reservation housing is just 85 acres, but we have a reservation base where our economic development is along the I-5 as well. It is not located where our community housing population is, but we are a very small tribe. But at the same time, we were looking at the service and meeting the needs of our community, that included our non-native citizens that reside within our community, and not just our tribal members. So that's a cross section of what we're doing within our communities. And the tribal government having representatives participating at the state level, at the federal level is a benefit for all of our organizations within the counties. So thank you so much for allowing me to share just a little bit of the work that the tribal governments have had with the accountable communities of health, not only in my region, but across the state. I've served on many of the governor's task force and committees, and it's benefiting all of the community population, and participated in the public health foundational work group of our former Secretary Wiesman, served on many of those committees that look at how we can increase access to healthcare for all of our population and benefiting the whole person. That's one of the key things that tribes and tribal health systems we have available is we are looking at providing the service for the whole person, and it's connected by the we have look at the environment, we look at the water, we look at all of those things around us that impact the health of our citizens and the neighboring populations. So, Heishka.
Nixon, thank you. Before we go to the questions, I just wanted to give opportunity to follow up if any of you thought of something you wanted to add after hearing each other speak. I know Dr. Barbara, Jessica, Santana, any additional comments before we go to the questions? Okay. There's a few questions in the question box and a couple of comments. The first question is, how does one learn the proper protocol for approaching any given tribe regarding a potential collaboration? Who wants to take that one? Marilyn, did you want to start off?
Sure. The protocol is, and this is one of the things that, and we have established the land acknowledgement. We have a protocol that's been established by the tribal governments together with the accountable community of health. And it is, when there is a individual or a group that wants to approach the tribal government and the protocol, and we have, during the COVID time, some of us had closed reservations because we did not want to have our citizens impacted by the COVID of having people coming into the reservation that normally do not reside within the reservations. But it's by resolution that the tribal government establishes the protocol of impact for outside organizations with the tribal government. But the tribes and the tribal government are open to working together, having the groups come into the tribe and within our reservation and provide services when it impacts and benefits our population. So it's definitely something that we're open to. And I always say that all of the years that I've served on my tribal government, the door is always open. And it's just approaching the tribe in a way that is appropriate, recognizing the tribal government as a sovereign nation, and that we have our own protocols, and we have our own organizations within our reservation, tribal law enforcement. We have, many of the tribes, the larger tribes have many resources within the community that is available to our population. And so it's just a matter of making contact with the tribal administration and appropriately approaching the tribe. Thank you.
Thank you. Anyone have anything to add to that? I think that was pretty clear, pretty thorough. And a question for Councilwoman Scott from Libby Watanabe of the Snoqualmie Indian Tribe. How long did it take to plan, coordinate, and implement the tribal liaison based at Providence Hospital? What an amazing success story.
Actually, the Tulalip tribes and the Stillaguamish tribes, they have had relationships with the Providence Hospital for a long time, even before the Accountable Community of Health. But when the Accountable Community of Health partnership began, then there was a further clarification when some of the assessments of the county, the public health community assessments were done. It was recognized that there was some of the care that was being accessed from the Providence Hospital with American Indians, Alaska Natives from the tribal communities that may not need to actually show up at the emergency department. And so the Tulalip tribe entered into an agreement with the first responders, as well as at times when their health clinic doors are open, they actually, the first responders may bring an individual if it's deemed that their care that they need is something that is more non-emergent. They actually will bring them to be triaged at the Tulalip Health Center. So that the partnership was entered into between the tribal government and the hospital for, it took some time for that coordination to happen. But tribal leaders, tribal health administrators, and the administrators of the local hospital were just open to having those discussions.
Thank you. And that is a really important position, and it's good to have that understanding of how the tribe's Indian health systems work. A question to Councilwoman Scott. What is the ideal role for ACHs and interested community partners in working with tribes and Indian healthcare providers to promote community health and wellness? Are there areas that you see are the greatest need and would be most effective? Sorry, you're in the hot seat today.
Well, what's interesting is that the Indian healthcare delivery system and the services that we offer, and each tribe, tribal government and tribal health system is individual as itself. So we're all very different in what services and what programs we offer. And so at times the community, the county, and the hospital assessments that are done, when tribal participation is included in those assessments. In years past, when the local health jurisdictions would do community assessments, prior to the establishment of the Accountable Community of Health, tribal governments were left out of that process. And more now, there, with the communication that's going on with the partnerships that we're establishing, it's opening more doors for there to be involvement. Individuals from the tribal health system are participating in some of those county and forums that are outside of the reservation, and it makes it improve. The one area that we have really struggled with is the integration of behavioral health with physical health in the state when the managed care was the integration. And during the pandemic, there's been an increased need for behavioral health with the isolation, and it's not just within our community, I know that, but we have had a increased number of losses within our community during the pandemic, suicides, various things happening within our community, overdoses, individuals that had been in recovery for many years, but because of the stress and many other factors, and lack of access to the behavioral health programs that could assist them. But during time with the isolation, that was an area that was really identified. We needed to figure out ways to improve access for individuals when they needed it. Many times we couldn't get them into the detox centers, and by the time our tribal behavioral health provider would connect them up with the services that they might need, it was too late. When we weren't able to get them in there when they were in a crisis state. And so that's been a hardship for our communities not to be able to provide those services or access those services. But we're working on that very with the state, across the state, with all communities, tribal communities, to improve access for the behavioral health system. And the American Indian Health Commission, which is our tribal organization statewide, that is establishing a hub that's going to be our connect for behavioral health and improving access to the beds that are available within the facilities across the state that we may need. So thank you for asking that question.
Thank you. And then the next question for anyone is, with the amount of time and effort that has gone into the relationship building between tribes, Indian healthcare providers, and ACHs, what action, either by an ACH or by the state, would negate or ruin the effort, potentially destroying the opportunity between tribes, Indian healthcare providers, and ACHs? Dr. Barbara, do you want to give?
Sure. Yeah, I'm happy to give it a shot, and I'm sure other people have a perspective too. I mean, I don't think that the relationship is that fragile. I think that there's been a strong, and partly as a result of the work of Councilwoman Scott and many others in the development of these processes and the development of that relationship. I think it sounds pretty strong. I'm a newcomer to Washington State, but have seen this model work throughout the country. I think that maybe to make a positive spin on this would be to maintain the strength of that relationship requires a continued level of collaboration, intentional collaboration, efforts to make sure that all partners are genuinely brought to the table and made to feel comfortable in expressing concerns, that their partnership, their collaborative efforts are valued. They're not just tokens. They're not just, like I said previously, ticking the box, but rather that their input is essential to the process and heard, and building on those things, carrying forward the initiatives that are expressed as valuable by members of those tribal partnerships.
Thank you. Anyone else have thoughts to add to that? I mean, you really nailed it. And then a couple of other questions. We've got about 6 more minutes, I think. Question for Dr. Barbara. How has the Colville tribe responded to the COVID-19 pandemic and behavioral health and substance use needs that that accompanied the health issues tribal members have been challenged with.
Thank you. Yeah, just as Councilman Scott said, there's been a great deal of loss on the reservation, on the Colville Reservation and elsewhere. Many people, elders, and of various ages have been lost directly due to COVID-19, due to the isolation that results from COVID-19 as a result of exacerbations of substance abuse and suicide. It's very, very tragic. And it continues, and we're going to see, I think, the effects of this for a long time. We have implemented some key strategies. Certainly, they're not universally effective, and we regularly reevaluate to determine their effectiveness. But those include, a strong telehealth program. I think, a great deal of that was the work of result of partnerships with NCAH and the state and various others. Incredibly important addition to our arsenal to maintain contact, because there was a period of time that folks were not really able to access behavioral health services, felt really cut off, and that contributed to made chronic disease acute, chronic health and mental health disease acute. The tribe continued forward with the development and the opening this week, the soft opening last week and the full opening this week of the Colville tribe's the Sampoil Treatment Center, adult residential treatment center for alcohol and substance abuse, and that has been a marvelous addition. And it really is kind of a symbol of the hope of being able to continue on and get through the pandemic, and served as a call point or a touchstone for being able to work together to get through these things and face the challenges together. High level communication, developing new communication media pathways. We haven't always been very good at that, and we still are working on it, but I think that those are some of the essential tools that we've employed.
Thank you. And Santana, did you have a response to the prior question that I missed for you? Because there's a question for you, but I wanted to give you an opportunity if you wanted to respond to the question about relationships and negative impacts. It's okay if you don't remember.
It's the question about like if there's like any action that would ruin that type of relationship.
Yeah.
I mean, yeah, I think there's lots of actions that could potentially ruin a relationship, but I like Dr. Barbara's approach about not doing that and like upholding those relationships in a powerful way. I think once you like going back to the mindset of like individualism, I think if you were to consistently have that mindset and not have any motive to change that, or if going back to what Dr. Barbara said in the beginning, as well as if you're not being genuine, then those feelings are definitely picked up. We can definitely tell when someone's reading a land acknowledgement that they truly mean it. You can hear it in their voice, in their stance, and their actions that follow that. So I think when you're not upholding what you're saying and following your ideas with actions, I think those can potentially ruin relationships.
Thank you. A couple of quick questions to anyone on the panel. How do you participate in the new peer navigator program to impact assist your programs in coordinating behavioral health or substance use disorder care for your communities? Is there participation? I know the Kalispel tribe is participating. I'm not sure about Colville or Upper Skagit.
Currently, Upper Skagit we have not actually utilized the peer navigator, because it's just being established within our region, and the coordination between the behavioral health ASO and the crisis responders and the tribal providers are just beginning to develop those partnerships, and I think there can be improvement in the future, but it's going to take some time for everyone to get those lines of communication open. Thank you.
Thank you. And it's time to close, but I think this is a good closing question. What does the tribal community or communities see that is lacking in the outside communities? And then what areas have you excelled in that the rest of the population can learn from? And anybody want to take that? I can give an example. I think the COVID response, the vaccination clinics are a good example. Dr. Barbara?
Yeah, sure. That is a great example. I mean, I think that and this example of I think what I was going to say, responsiveness. Sometimes it is the bane of my existence, my work here, the fact that tribal council members tend to be so much more responsive to the needs of their community members and directly responsive to and responsible to, accountable to their individual community members on a daily basis than I think we see in government outside of the tribes. They're advocates for their people, strong advocates, both internally and externally. And I think we could use a lot more of that type of responsiveness, both in government-funded programs and in government roles in elected positions outside of tribal communities. A responsiveness that is not the result of self-interest, but rather of, you know, this is my community, this is my project, I want to see it succeed and work through because it's the right thing to do. I think that is the reason why the vaccines, a respect for elders, a respect for the community, a respect for the life and success of the community is one of the reasons why the vaccination drives were so successful in Indian country.
Thank you. What a great response. Santana, and then Marilyn, I'll let you have the last word.
Yeah, I got to witness a lot of the work that Lummi Nation did within the COVID pandemic and the vaccinations. I mean, we turned our whole fitness center into a mini hospital. We had so many vaccinations that we opened up to the Ferndale district, and all of that just became that was a huge part in, you know, acting on, you know, who we are as a people. You know, we are a giving people and we share. So to be able to open up those vaccinations to the broader community definitely spoke a lot to who we are and the relationships that we're willing to establish. I shouldn't say everybody, but you know, a lot of people know that there's a long history between Ferndale and Lummi, and to be able to come to a point in time where, you know, we want to get past that because of what we've all gone through within the pandemic, I think just showed a lot about the process and what we're willing to do to help everybody throughout COVID. So yeah, I think a lot of the work that Lummi did was really hands down just really amazing, and they expressed a lot of gratitude throughout that whole process.
Thank you. And Councilwoman Scott, do you want to give us last thoughts, and then we'll turn it back to Bonnie?
One of the things I wanted to just say is that in our region, the partnership that we had between the tribes and the ACH, we were able to get, you know, the ACH was able to put together food boxes and supplies for the families that were impacted, that were isolated and were having to be in their homes. The support of the ACH and the tribes coming together really benefited all of those that had that impact where they were isolated and not allowed to go out of their homes. And when families were in the quarantine, the policies and the protocols that were in place, tribal law enforcement would deliver water, would deliver supplies to the families' homes, but we were able to get food boxes that were put together by the ACH to the tribal communities. And when we had need for supplies, masks, whatever supplies we all worked together to help the communities within the counties, within the tribal communities. We all work together. I'm just, just like Santana said, we also worked with our outside neighboring communities by allowing the outside community, when extra vaccines were available, to our employees, that as well as our local community, school teachers, some of those other communities. And for us, we did not have the capacity to store the very cold requirements for the vaccine, and we were able to, Lummi had the capacity to do that, and so we were able to benefit from the vaccine being made available for us through Lummi having the capacity with the cold storage to be able to hold on to the vaccine until we needed those vials. So with that, I just wanted to say that it's been a really good time this morning to share a bit of our partnership within the state and the ACH's Haishkasiam.
Thank you, everybody. Thank you to our great panel. Thank you to everyone who came to listen and understand. And want to turn it back over to Bonnie to end us for the day, I think. Thank you.
Thank you all so much. What a great panel this has been, with just so much wisdom and experience to share about how to really meaningfully collaborate and really what is working. So thank you all so much. And thank you to everyone who joined us today for all of today's panels. I hope you all learned as much as I did, and I want to extend just a huge thank you to all of the panelists and moderators for sharing all of this important work and learnings with all of us. We really hope you'll be back tomorrow. We have 3 more really great sessions. We'll have panels on advancing integrated care. We'll have a panel on the future of accountable communities of health. And then we're really excited for our closing keynote from Yolo Akili Robinson. He's with the Black Emotional and Mental Health Collective. So that'll be a really great way to round everything out. So have a great day, everyone, and we can't wait to see you in the morning. Thank you.